I did my internship at St. Vincent's Hospital in the Greenwich Village, which was literally where the first cases were identified. And I clearly remember these young men coming in with this really devastating illness that we had no idea what was going on. I think the great news has been the development of treatment regimens that can prolong life of anyone infected with HIV. On this World AIDS Day, I hope all of my colleagues will recommit themselves into ensuring that everyone with HIV infection is identified and put into care, and we enhance our prevention efforts to reduce the all too high incidence of HIV infection in our community and indeed the world.
I'm Jessica Yeager, the Medical Director of the STAR program, and every year at World AIDS Day, it's a great opportunity to remember all the progress that's been made since 1981 and all of the people who are living healthy and engaged lives who are living with HIV. We're so excited this year to celebrate yet another World AIDS Day and to remember everyone who continues to live with and thrive with HIV.
Dr. Conrad Fisher, I'm an infectious disease specialist. I've been seeing HIV-positive patients for the last 30 years of my life, and I'm a professor of medicine. But what I'm most proud of doing is seeing patients here in East New York and Crown Heights as part of the STAR system. And World AIDS Day has been around since nearly the beginning of AIDS, and is a time where people can remember their common humanity. That it is a common humanity that makes sure that we need to take care of everyone in this world. There is no religious or cultural other when you see it from the point of view of one humanity in HIV.
So this is a World AIDS Day. It's very important for all of us as a provider and all other staff, nurse, social work, and also most important for our patients. Because this is the awareness, and we can educate our patient, we can educate our community, and for HIV prevention, HIV treatment, and also we can remove the social stigma, which is the most important barrier for our patient, for us, and for our society, our community. So on that day, we can we can get together, we can celebrate our success, and we are progressing in terms of our HIV patient and his patient's care, and also we can educate our patient, our community people, and this is the way we can progress and we can control the HIV, and someday we'll win and we'll remove the HIV from our community, from our population.
My name is Annette Tomlin. World AIDS Day means to me 2024. It's an evolution of what the stigma and how we actually progressed from the beginning to where we are at now. The epidemic that still continues, how we strive to improve quality of life with the new medications. It's just a beautiful thing. At the same time, it's unfortunate that we still have this stigma. The stigma and how it has been labeled and how it actually categorized people, I think, is shameful. It's unfortunate. Like any other illness and any other disease, where some people are able to emphasize and sympathize with the way AIDS and HIV had been labeled and categorized again, was to have like a shame, like a scarlet letter. For those who are survivors, such as myself, I've learned to sort of wear it as a badge of honor. I'm thankful, I'm grateful. Because of the medications that they have now, people are able to actually live longer and have more productive lives. Of getting tested without knowing, because everybody has a status. It's either positive or negative. You don't want to live your life and understanding or not understanding the full comprehensiveness of what it is to have an opportunist illness, because these are certain signs and symptoms that are part of the HIV virus. You don't want to become a carrier like persons that had the COVID. It's not prejudice. It affects any and everyone, regardless of your age, in the sense of you're not too young and you're not too old. You know, people look at the stats and they think that they're safe, and unfortunately they're not. So again, the best way to understand where you stay at, or where you actually are at, rather, as far as your status, is to actually get yourself checked.
Survival. Yeah. And it's about survival. All the things that I do is about survival.
My name is Thomas Powell, and I'm a client at the STAR program. I got diagnosed in 2006, and during the course of me coming for my treatment and being medicated adherence, going to the men's group here, I started to be acclimated more into the STAR program services and what they do here. So I joined the CAB here, and I became the vice chair of the CAB, which is the Consumer Advisory Board here. And we did some miraculous, wonderful things with the clients here, and that's what kept me coming. We are survivors, and I'm one of those survivors because I had 37 friends that I grew up with, and now there's only 5 of us. Yeah, and it was a pivotal time in everyone's life that being a survivor really mattered. Even Black Lives Matter, but survivals matters just as well.
I'm 74 years old, and I've been diagnosed since 1986, and I'm living. My name is Joseph Smith. I'm so grateful to be a part of this presentation for all people, young and old, who are dealing with HIV and the stigma of HIV and AIDS. You know, I was diagnosed in 1986, and my T cells were like 4. I didn't do anything about it at the immediate time because I was working as a staff member, but I had clients that were HIV positive, and I didn't know how to deal with their emotions or feelings. And I was requested to take the test, and I did not found out. And I was devastated, and at that moment I had the compassion to understand how people living with HIV or newly diagnosed, how they felt, because I had that compassion. I understood, because now I realized I had it. You know, it always gives me hope. And that's the most important thing I have to share about this. It gives me hope, and I can help other people when I share my experiences. And you can live. You know, I go out, I do things, I have an active social life. You know, I go on trips, I go bowling. You know, there's nothing too much I don't do with the virus that I didn't do with the virus, with not having the virus. You know, so I'm grateful and thankful for allowing me to be a part of this presentation. But there's always hope if you choose to take the action for it.
Hello, my name is Michael Anderson. I was diagnosed June 10th, 1991, which makes it 30 years that I've been living with HIV. I think that everybody can live with HIV as opposed to thinking about dying from it, because it worked for me and it can work for you.